Actually, there's a, yeah, there's a PGA tournament here in about 3 weeks, I think.
Are they having you as a guest golfer?
Yeah, no, that would be deadly for them.
They might have a lot of fun. Hi, Chris.
Welcome to the January 31st, 2022 meeting of the Rotary Club of Jamestown. Please join me in reciting the Pledge of Allegiance, singing of our national anthem, and repeating the four-way test. Pledge allegiance.
The flag, the United States of
Pledge
America.
allegiance to the flag to the United States of America and to the republic for which we stand,
Stands
one nation, under God, indivisible, with liberty and justice for all.
Can you see by the dawn's early
Can you see by the dawn's
Morning, Sandy, to drink.
Buenos dias.
Yes.
Not quite.
No, no,
A little
okay.
bit.
Thank you. My name is Marco.
Let us repeat the four-way test. Of the things we say or do, is it the truth?
Is it the truth?
Truth.
Is it fair to all concerned?
Is it
Is
fair?
it fair to all
concerned?
concerned?
Will it build goodwill and better friendships?
Will it
Will
build
build
good?
goodwill and better friendships?
Will it be beneficial to all concerned?
Will it be
be
beneficial
Beneficial
to all
to all
concerned?
concerned.
Thank you. Our invocation today is from Becky Robbins.
Thank you. Good God Almighty, it's cold. It's a miracle that we survive at all. Don't let our hearts be frozen. Make us conscious in the cold of those who shiver for want of kindness, justice, and compassion. Groundhog of all being, wake us from our hibernation, at least long enough to recognize the world around. Let us not shirk from our shadows, but rather face the unresolved. Let us confront those things that need changing and accept the things that simply are. Don't let us rush back to sleep prematurely. O you who descended into the earth and rose again with the dawn, open our eyes to light, even in the cold, crisp light of winter. Let it awaken in us irrational hope, the unreasonable possibility of spring in the depth of winter, the possibility of kindness in a world desperate for warmth. God of the meantime, let us huddle today, together while we wait. Let us nestle and dream, reach out to each other, and comfort each other in the warmth of our prayers. Amen.
Amen. I don't hear anything.
Foundation. So at I can't remember the time, around 6 or 6:30, it's just our 7090 group gets together. And then an hour later, It's a Zoom meeting with the whole foundation for Rotary International. So it shouldn't go longer than an hour after, so 2 hours tops on February 23rd. And I was derelict and didn't send you the email this past week, but I will this week. And the cost is $120 and 100 of it goes to the foundation. 20 of it is for the cost of putting the event together.
The Lancaster Depew Rotary is having their centennial celebration at Russell's Steaks, Chops, and More from 5 to 7 on February 24th, and you can register through their website. Do any other chairs or committees have announcements? All right, with that, we can get our 50-50 tickets out. Melissa Myers has the bucket. Sure. No, you're fine. How much to the winner? 33 to the winner, and the winner is 232. All right. Congratulations, Sally. Mr. Conroe, Doug?
Yes, sir. Hello, good day. Happy 4-degree day. Wow. Going to be quick today. I'm only looking for one person and I do not see him in the room, nor do I see him on the tube. Phil, haven't seen you in a while. I'm sure you've got something to donate to the pot and a comment to make. Glad to have you back. Glad to have you back. And if there's any Bengals or Rams fans in the room, no. And if anybody bet on the Chiefs, add your losing bet up here.
Do I get to say words or do I have to come back up?
You are more than welcome.
Yeah, I happily pay that fine. I know this isn't happy buck time, but I'm not coming back up. I missed Marion Beckerink's retirement celebration at the Jackson Center. And I know she'll forgive me, but I think we all should recognize the fact that she served there long and well and was a great and I want to say early edition when they were just tooling up over there. Thank you, Marion.
Okay, Mike, words of wisdom.
I grew up 50 miles. I grew up 50 miles from Riverfront Stadium where the Bengals used to play. I'm a Bills fan, diehard, love the Bills. But this is a team that won 2 games 2 years ago and are now going to the Super Bowl. So Who Day.
Yep, the Who Day team, sure. Come right forward.
This is just to make up for last week. You called me out regarding my little brother, my parents' favorite child. So got to put the money in now.
Yeah. Thank you. Yes, yes. Let's see. Now let's see a couple more things. I'll get you here in a second. Lee, come on up. This is Spacecraft Week, in case you didn't know that. I just made it up. On this date in 1966, what happened and who did it? And it relates to the moon. Does a table know? Let's see. Kurt, does your table know? The first soft landing on the moon. So tell us who did it. Luna 9, Russia. Ooh. Earlier on this date, 1958, the first artificial, I think that's interesting, space satellite orbited the Earth. What was it called? Mark Olson. In 1966, the first 1958, the first US space satellite orbiting the Earth.
Mexico knows.
Mexico knows. That must be Sue that knows, eh, Greg?
No, it's Sputnik knows.
Wrong. Pay up.
Oh,
You can do that electronically, Greg. Explorer 1. Everybody remembers that. So,
oh man.
okay. So
Okay, back to my Bloody Mary.
back to your Bloody Mary. And just a little note, a big note, on this date in 1865, Congress passed the 13th Amendment and sent it out to the states for ratification. Do you know what the 13th Amendment was, Lee?
Nope.
You sure about that? Oh, what do you think it was?
Abolishing slavery.
Perfect. Are there other happy bucks?
Here's just a note of interest. There's a copy in Warren, Pennsylvania at Betsy Industries of the 13th Amendment to the Constitution, signed by more members than any other of the 4 documents, including the one in the Smithsonian. It's at Betsy Industries in Warren, Pennsylvania.
Wow. Thank you. Well, I'm going to take us back to football. I was just planning on doing this ever since last night. I'm a Detroit Lions fan. Nobody even knows about the Detroit Lions any. But Matt Stafford toiled many years in Detroit faithfully, and we were all really sad to see him go, obviously, because he's a dynamite person, wonderful family man. And to see him now going to the Super Bowl is a thrill for all of us Lions fans. So go Matt. Oops, I'm gonna walk over.
There's all kind of good news, and we just have to turn both ears on so we can hear it. In about 2 weeks, on the 16th of February, wonderful things happen because spring training begins at the major league level. If you look at your calendar, you'll see sometime in June, about the middle of June, there'll be wonderful, wonderful baseball down at the stadium as all of the skunks are coming back to town. So don't be afraid of the skunks. And if you have any problem, before you leave the house, just smear some perfume under your nose and you'll never smell a skunk at the stadium. So we'll see you all at the stadium, perfumed or not, and enjoy the baseball of that team down there. And you'll realize that many of them that are out there on the field, whether they're the local team or the visiting team, some of them themselves are on the way to the Sports Hall of Fame in Cooperstown. So you'll get to see the best and enjoy. Thank you.
And enough football. Here's for the Aussies winning the Australian Open.
Thank you for all your happy bucks. Michelle Jones wants me to announce that social committee will be meeting at 4 o'clock tomorrow at Lakewood Northwest Bank to discuss Farch event and probably other social activities. And apparently Joel Washer's husband is also a Lions fan. All right. It's now my pleasure to invite Tori Ergang from the program committee to introduce our speaker for today.
Okay. So it's my pleasure to introduce to you Dr. Elizabeth or Betsy Kidder, who's a native of Jamestown. She is a board certified internal medicine doctor who returned to the region in 2017. She reminded me that she actually spoke to our club right about that time, but like many of you, I don't remember anything that happened before 2020. So it'll all be helpful. She's practicing at the Chautauqua Center. She's certified to prescribe medication assisted treatment for opioid addiction, and she's working closely with community partners to improve access to needed addiction treatment in this region. And that's a topic we've heard about at our club before. Betsy graduated from Jamestown High School. She received her Bachelor of Arts from Boston College and later her medical degree, MPH, and PhD in public policy and health policy from the George Washington University in Washington, D.C. She completed her residency in internal medicine at George Washington University, and she's previously worked at the UN's World Food Program, the National Academy of Public Administration, the Global Health Council, and the Department of Defense's HIV/AIDS prevention program. She currently serves as Vice President of the Chautauqua County Board of Health, which has to be a very difficult role right now. She's also chair of the advisory board of MHA, and she was actively involved in the fundraising campaign for the new hospice house in Lakewood. And I just would like to say, I feel like probably a dozen years ago, I remember I had three jobs ago for me working in healthcare recruitment. And Betsy was in the process of securing all of those credentials and came to a little mixer. And I thought, wouldn't it be great if someday she would come back and live and work and raise her family in our community? And it took a long time, but it really did work out. And we're so blessed and fortunate to have her and her husband, Jim, and their 2 children here. So Betsy.
Is this on? Thank you, everybody. I'm so glad to be back, and thank you, Tori, for the invitation. And I think we're good up here. They hear me through this, right? Okay. I was here in 2018. I moved back in 2017, and Becky Robbins invited me at that time to come and speak about addiction treatment. And so I'm not going to touch base a lot on that today, but I'm happy to answer any questions anybody has at the end of this. Tori asked me to tell a little bit about my pathway back here, what brought me back to Chautauqua County, and reflect a little bit on our own healthcare workforce. We are very understaffed at this point in time. I think every industry is, at least it feels that way. And it's tough to get people to come here and work. And we have had a very exhausting 2 years in the healthcare field, and there's not a lot of glimmer of hope in terms of good staffing right now to kind of get us back to square one. So I thought I'd focus on that, and then happy to answer any questions afterwards. So if I can, how does this go push forward? Is it just the arrow slide? Okay. Okay, so Tori's invitation allowed me to kind of think about how Rotary has impacted me over the years. And it was actually a fun walk down memory lane a little bit, and I'll show you a few pictures. My husband and I were talking about it as well, and he has a deep history in the Children's Vaccine Initiative and the World Summit for Children. He was chief of health at UNICEF for many years, and he reminded me that Rotarians are really known as the most significant civil society player in children's vaccines. Somebody's requesting remote control of the screen. Do I just decline that up here? Okay. And in the end, it really made us both, as we were talking about it, think that all health is local. We look at our outcomes here in Chautauqua County all the time, and some of them really reflect some of the developing country health outcomes that my husband and I have seen over the years. So lots of work to do here. So I thought I would just give you a timeline here and take you through my pathway back. Tori kind of gave you a brief overview of it. But it's important, I think, to understand it was fun for me to go through and say, how did I actually ever make the decision to move back here in the end? And what did it come down to? I was a JHS grad. I was born here, WCA Hospital. I think some of you know my parents, Jane and Raleigh Kidder. During my growing up period, we probably hosted at a minimum 1 Rotary Exchange student a year from the time I was 6 to the time I graduated high school. So lots of exposure to other cultures, different countries, and that set me up for being a Rotary Exchange student myself. So I must have been I don't know, probably a freshman in high school when I knew that I wanted to spend a year after high school away. And this sent me looking through my old photo albums. You ready for this? I found it. The blazer heading off to Spain. This was 1996 when nothing was digital, so I really had to go digging and scan it. But I spent the 1996-97 year in Spain. And what came out of that, besides lots of fun adventures, was that I learned how to speak Spanish. And I use that probably in 25 to 40% of my day every day here in Jamestown. And this is just a fun picture of me voting at age 18 for my first presidential election by mail ballot from Spain. If you know my family, that day was not going to be missed. Okay, so after Rotary, I went to Boston College, very interested in international studies and policy. I thought that was where my career was going to take me. I did pre-med on the side, just so I kind of had like a fallback if I decided to go into the clinical world and the scientific world. But really, I thought I was heading down the working in Washington, D.C. and at one of those 3-letter organizations and probably spending my career there. I then spent a year, my junior year in sub-Saharan Africa, and it was there where I did quite a bit of, got into public health, I'll say. The AIDS epidemic was raging through sub-Saharan Africa at that time. They didn't know a lot, the community members didn't know a lot about HIV. They did not have access to a lot of good information. And I ended up volunteering and teaching a course to high school kids while I was there. And I was no expert, but I knew a heck of a lot more than they did. And so we basically talked about public health and HIV every week for the year I was there. I also had the chance to volunteer in a hospital there, which was very eye-opening. And it really sent me down the pathway of public health. So I came out of undergrad with a pre-med background, international studies, and decided I was going to pursue my career in public health. I started a master's in public health out in San Diego. I followed my boyfriend of the time out to California and started it out there, and quickly realized I was not a California girl and I was missing the East Coast vibe, and transferred my master's in public health program to Washington, D.C., which was a much better fit for me in the end, and pursued the degree there, and really focused on global health policy and epidemiology at that time. I ended up sticking around DC after that, working for the Global Health Council, and got a real fun opportunity to move to Italy, where I worked for the UN World Food Program on an initiative to end child hunger and undernutrition. This was public health at a very high level, and it was fun, and it was pretty heady for a kid from Chautauqua County to be living in Rome and doing this stuff. But I missed the human connection, like feeling like I was making a difference in people's lives. And I thought, oh, geez, is this the time I'm going to go back to med school now? By this point, I was 29 or 30 probably, and which was a little late to apply to med school. All the undergraduates that I graduated with in Boston College had already gone to med school and were pretty much done at this point. So I went back and studied all that organic chemistry and everything else I needed to do to pass the MCATs, and applied to med school and decided that that was going to be the pathway that I went. I did med school at George Washington University in Washington, D.C. During that time, I got married, had a baby, bought a house, got a minivan, you know, all the things you got to check off the list. And one positive thing that came out of that all, or lots of positive things, but in the mix of it all, I had my son, Jack, who's now about to turn 12. He was a newborn, and I had to arrange some outside rotations in medicine. And so I thought, well, why not go home, let my mom and dad help me? And I did several rotations up here. Dr. Lamancuso, I worked with Dr. Christina Brown, Dr. Burke, and then I went out to Ripley and worked with Grant Stevenson out there. And those experiences really shaped the idea that I could come back here anytime and it would be interesting medicine and a fun place to live. So I failed to mention that at the time that I applied for to go to medical school, I wasn't ready to give up health policy and public health. And so I decided, why not apply for a PhD at the same time? And I had to sort it out with George Washington University to complete both degrees because they didn't have a joint program. And they allowed me to do so. And I kind of calendared out my pathway and how I was going to do it. So I took courses all through med school for the PhD, and then I finished my dissertation once I finished med school in those 2012 to 2014. And that was all about access to cervical cancer screening for underserved women, which again has come back to help me out here in my work that I do in Chautauqua County. Then I had 3 years of internal medicine residency, and luckily it worked out for me to stay in DC where my husband's career was, and they had an excellent primary care program within that internal medicine residency. I knew from the get-go I wanted to be in outpatient medicine and to serve the population, an underserved population, and luckily I've been able to find that pathway here in Chautauqua County. So in 2017, we moved, and I'll talk a little bit about what happened between 2016 and 2017 that actually took place. And then I got here and I interviewed all over town at all the different practices. And I knew instantly that the Chautauqua Center is where I should be. I am an internal medicine doctor, and I do that about 75% of my time there. And the other 25% is addiction medicine and women's health that I do. I love the model of care. I think Mike Peace was here not too long ago who talked about what we do, but it's having everything under one roof and working with mental health and dental and really taking care of the patient as a whole is a lovely way to do it. So this was a bit of a no-brainer for me, but I will get into it a little bit. Federally qualified health centers don't pay much. And when you come out of a big, long degree, you got tons of debt. So there's some financial levers that work for both those of us coming out of the healthcare services fields and other fields to try to lure people back to Chautauqua County. Okay, and I think Mike probably showed this, but we are building a similar building. Oops, sorry about that. In Dunkirk, and it's supposed to be open late spring of this year. Okay, so what happened here? What got me to move from Washington, D.C., where I was very comfortable living on Capitol Hill, great neighborhood, good schools. And the answer is lots of reasons. For me, family circumstances probably played into it most strongly. I think many of you know my parents. My dad was not walking well at the time and had real bad back, and we thought he was going to be in a wheelchair. So I asked him where he wanted to live, and he said, right here where I am in my house, in a rocking chair sitting on the deck. I'm like, well, okay. So we kind of kicked into action and started to build all one floor ADA accessible apartment onto the house where they live, which required me to move back ASAP if I was going to be in charge of that process. So we moved up here right away, put the kids in school in 2017 in Bemis, and the rest is history, really. Of course, my dad is not in a wheelchair and he's walking around just fine. So with a walker. So it maybe was unnecessary urgency, but it certainly felt that way at the time. I also have a very strong connection to Chautauqua County. I feel it. I think spouses who come back here or people who don't have any connection don't have that. And that was a super magnet kind of bringing me back. I also knew I could get engaged in the community easily back here. And that is something I wanted to do. So that was good. My husband is a Detroit, Michigan Lions fan. We cheered for Stafford for sure. And this was our chance to get him 4 hours closer to Detroit from where we were in Washington, DC. So that was the selling point, getting them back here. But there are lots of hiccups for, young professionals trying to get back here. For one, I mean, my husband's career was international, global, and based out of New York City and Washington, DC. So he traveled the first 2 years we moved back 4 to 5 days a week. And this is not an easy place to commute from. So it was a big stressor. Then COVID hit and he was grounded for the first time in years. And so that's actually been a little bit of a silver lining for us. There's not a lot of when you move here from the big cities, there's not a lot of diversity, and we worry about that, raising our kids, and wanting them to see all that. So that factored in, but we knew, we could give them experiences. But I think that is something that people who aren't from here looking in at, do they want to move back to Chautauqua County, or as my dad calls it, the backwater of Western New York, you worry about some of these things. And then finally, I'm going to spend a little time on this one, which is debt, because getting professionals to come back here, we have some very specific and special financial levers to use in our recruitment that I think this group would be interested in knowing about. There are 3 major loan repayment programs out there, and you'll see them here: the Public Service Loan Forgiveness Program, which is federal; HRSA, Health Resources Services Agency, also federal; Service Corps; and Doctors Across New York. There's also similar other ones in New York for nurses and other healthcare staff. When I got done with my training, I had $400,000 of debt. I am participating in all 3 of these loan repayment programs to try and pay this off. When you go into primary care and you choose the lowest paying job in Chautauqua County, you need all of these options. It's a full-time job keeping track of when you can apply for what, which ones you can be a part of at the same time and which you can't. And this is something we certainly need to be knowledgeable about and help in our recruitment services, bringing people back to Western New York. I really want to highlight the Public Service Loan Forgiveness Program. Basically, if you work for a government agency, a 501c3, a public school, and you make 120 payments on an income-based plan, everything else is forgiven. And you can see the different, this is not just health services. This is school teachers, law enforcement, public safety, military. This covers a lot of people that we can recruit back to this area. And it makes a difference because we don't pay competitive salaries here when you're trying to compare it to the even Buffalo or Rochester area, regional areas, and then certainly not if you're comparing it to the bigger cities. But when you factor in these types of programs and loan repayment, we start to get a little bit more competitive as a community. The National Health Service Corps focuses on nurses and doctors and PAs and nurse practitioners, psychiatrists. And they give you money if you're working in an underserved area, a medically underserved area, or a health profession shortage area. And so we qualify here in Chautauqua County. This is the map of the United States of primary care shortage area, and I'll zoom in here. But we certainly are one here. The highest score you can get, meaning you're most underserved, is a 26, and we score between a 17 and a 21 here in Chautauqua County for primary care. For dental, we score even higher, 18 to 26 for dental health access. Mental health, we're between a 17 and a 19. So in all these areas, people who work and serve patients in these qualified settings can qualify for that money. And that's $50,000 over 2 years, so $25,000 a year, or $75,000 over 3 years to help pay back loan repayment. And then just coming back to Chautauqua County here, of the 62 counties in New York State, we frequently are among the lowest 3 to 5 in terms of our health outcomes and the social determinants that impact that. And we see so much smoking here. We know about our poverty, housing, access to quality food. And we have so much work to do. And in reflection, we do not currently have the workforce capacity in this county to respond to the situation. That's why I'm kind of zeroing in on this and how we can recruit professionals in this realm back to Chautauqua County. Just some thoughts and ideas for you as Rotarians and where to focus some of our efforts. SUNY and JCC do have good nursing programs. We've got a medical school out of Buffalo, doing as much to support our high school students to see a good pathway forward in the healthcare services and kind of court them from a young age, as Tori reminded me of, having them back for visits and to let them know that we have a good healthcare infrastructure here that can give them a good career and they can raise their family. For me, community connection was a huge driver. You saw that when I got back here, I got roped into quickly being on the Board of Health, chairing the Mental Health Association Advisory Board, getting pulled into a bunch of different fundraisers. I wanted it. I was happy. That was one of the reasons I came back. When you're an outsider and you don't have decades of family connection, it doesn't happen. And it's hard to keep those people here when they don't feel connected to the community. I just lost a close colleague who went back to Toronto. She was an excellent doctor, just never felt embedded in the community. And I think that's where groups like Rotary can be helpful. I mean, to really reach out and include some of these newer folks who don't have deep roots in this community in what Rotary calls your fellowship of business professional and community leaders to keep them. I think that's it from me. So I'm happy to address anything, take questions. Not sure if the online folks, do I get out of this so the video shows up? I know part of that probably falls to people like me who know they're coming in and need to connect them in with organizations. Sometimes it's hard. Sometimes there's a cultural barrier, and I think it's hard. I just interviewed a couple people from New York City that were trying to get to come here, and they're of Pakistani background. They've had a practice in New York City now for years, and they're thinking about coming all the way out here to Chautauqua County with no connection and settling. And I thought, oh my gosh, how do we keep these good doctors here when they come if we don't have, a community they're familiar with, or we're not actively engaging them from the get-go. So it's extending the invitation. I was just thinking about it with Tori as we were talking here at the table. It's hard to come to things like this when you're a doctor, because we don't get this kind of time off during the middle of the day. So I was thinking of that Rotary would be a great place, but then logistically it's tough. So what other community organizations that you all are a part of can you think of that are membership based, or that, I don't know, AM Rotary? I know there's only two, AM and PM. It's a great model. Maybe this whole having Zoom as an option actually really expands the ability for more people to participate than otherwise would be able to get away during the middle of the work week. But there's a big group of people out there, I think, that aren't connected in to what I think of as the social fabric of Chautauqua County, which is strong and deep, but can be very, what's the word I'm looking for? It's not that, yeah, I guess. And I don't know, that's a challenge for us. I wish I had the solution or the answer, but I don't. But let's keep it in mind, and I'll certainly do the same and try. I'm only one person. I can only do so many tours and have so many dinner parties and stuff when the doctors come into town. It's nice to do it a little more deeply. That's a good idea.
So Betsy, I'll issue a challenge to you. Rotary International is pushing more for broadening the Rotary model. And so we have satellite clubs that we're able to form now. That would make them a member of this Rotary Club here, but being a satellite could determine their own times and places of meeting, step format of the meeting. So a lot of independence. And you know, we need like, I think 8 people in order to make that start.
Okay, that's, am I? Depends on what time of the year you give them a tour. But I do think that, I mean, I find it beautiful around here. It's a gorgeous place to live. We're looking for people who want a more rural environment. The schools are good. The cost of living is low. It's not so easy to get to though. So I think those are the kind of 3 big pieces. Loan repayment, we have great opportunities for people. And the one thing COVID might have given us is a desire for some people to get out of the big city and look further than they otherwise would. Certainly it's showing in the housing market, right, where things are just getting bought up. And I'm hopeful that that move translates into professionalism as well. And it gives us a little revitalization. But yeah, I mean, I had an obvious reason to come back with such a connection here and family. And it's sometimes a hard sell for people who have no roots. So that's why I'm trying to, you know, strain my brain and all of yours and think about how we plant their roots as soon as they get here and keep them planted with us. Absolutely. I think I know there are some programs in Jamestown Public Schools, and actually you guys are having the principal here next week, I think, to talk, trying to encourage and show a career path, because a lot of kids don't know how you get from here to there. If they, you know, I want to be a physical therapist, great, this is what you need to do. You know, and there's not necessarily a clear path, but there are some programs that are trying to teach that, but I think they need to be more ingrained in our local high schools, probably from 9th grade, when people start to kind of form their minds about what they want to do. It's excellent, I think. So I was worried it was going to go away as the pandemic kind of came to a less of a roar over the summer, because the insurance companies don't necessarily like to pay for telehealth, but luckily it looks like it's here to stay. And it provides so much flexibility to see and treat patients who can't get in or have questions, but doesn't require a full-on physical exam. Certainly for mental health, we've had just a crisis in mental health. I mean, anyway, then you add on the anxiety and depression of living through a pandemic, and those services are in more demand than ever before. And we are doing lots of telehealth. I kind of sprinkle it in my day, see 2 patients, jump on my computer, talk to 2, go back to the exam room. I just do it and as much as I can. So I think that is a positive change that's here to stay. Thank you for having me.
Betsy, a couple of comments from the chat box. Rotary is trying to do evening meetings and social events that are after hours. You're welcome to attend any of those. And from Paulette Klein, retired health commissioner and 33-year part-time resident of Chautauqua County. She's happy to assist you in your efforts to recruit. All right. One of Rotary's major international programs is the eradication of polio throughout the world. We are down to just 2 countries in the world where polio exists. In honor and thanks of your presentation to our club today, we will be making a donation in your name that will vaccinate 4 children who will never experience polio in their life. And remembering this year's Rotary International theme, serve to change lives, caring for and serving others is the best way to live because it changes not only other people's lives, but also our own. With that, we are adjourned. And if you're sticking around for the Vision Committee meeting, we'll leave Zoom up.